Well, it's fall in Florida, but that doesn't mean we're going to see the beautiful leaves changing colors. No, if we want to see changing colors, we need to plant new flowers because after such a hot, wet summer, not all of my flowers have survived. Some of them gotta go. Some of them just need to be deadheaded, refreshed, and then they will continue, which is awesome. And I'm wondering, are we as observant about things going on within our body as we are about things in nature, like the leaves and like the flowers? So today I want to talk about pelvic floor therapy and rejuvenation because this is something going on within a woman's body primarily. That's who come forward has issues they want to address, but we are going to focus on those female issues. And the question that I'm answering, what can you expect from a pelvic floor therapy session, and what can you do on your own? And there are many options. I'm only going to highlight three, and truth be told, these three are the in-person experiences for therapy. I do have more to share, practical tips that you can do. But if you live in a big city, you might be able to find someone who offers pelvic floor therapy. And this is from my personal experience and my professional research. What are the three you might find? First of all, you might find a trained medical professional who will offer manipulation, so that is physical, hands-on. They might also offer instruction on how to use dilators to help with pelvic floor strength, and what is the proper way to do a Kegel exercise. And all of that is very helpful. Number two, a second type of pelvic floor therapy that you might find is a trained physical therapist or a trained medical nurse who has gone through additional training, a specialty training specifically in the pelvic floor. And they can offer a wide variety of things. Primarily, they will be using biofeedback to let you know what your resting status is for the health and the strength of your pelvic floor and what you can do to improve that. And it's really cool because they use sensors and probes, and these will be put on the abdomen, the rectum, the vagina, and there will be a slight vaginal stimulation, and they call this a low-level electrical impulse, and that causes the muscles to contract, kind of wakes up those weak muscles that have been inactive, and it retrains the brain to help it to fire. It's amazing, absolutely amazing. Now, the third type of physical therapy that you might be able to find in person at a facility is the Emsella chair, and I should use air quotes around the chair. But this is a non-invasive procedure, and you are fully clothed and you're sitting in this chair-like structure. It uses electromagnetic waves, and it sends it directly to the muscles, so you do have to get positioned on the chair appropriately to help that to fire. It causes this energy is sent to the muscles, and it causes them to contract deeply and rapidly and much stronger than a voluntary Kegel exercise. That means something that you as an individual would be thinking and manning. The machine, the chair, does it for you. So powerful results for these in-person procedures. But maybe you don't live in a big city. Maybe your health insurance won't cover that. Maybe it's just not the right time in your life to choose that. And you might be interested in something that you can do at home. So that's what I want to tell you right now. These are clinically proven guidelines, Kegel exercises to strengthen your pelvic floor. I have 3. I reduce things to 3 often because I know that helps us to remember things. So, number 1, you have to use the correct muscles. Did you know that was a thing? I know back in the day, Kegel exercises were really focused on the vagina, and that is not the main focus of how the instruction is now. The idea, and this is blunt, but I'm giving you a heads up here. So the idea is all of the muscles in the pelvic floor to be used, which includes the vagina and the rectum area. It's like a hammock sling down there, and you want them all to be working together. So the catchphrase is hold back gas. So imagine you're in an elevator full of people and you have that sensation, oh no, I'm about to pass gas, but that would not be something you really want to do. And you get that clamp on feeling. You're really tightening those muscles. Well, that is the sensation that we are going for. Number 2, you want to incorporate a cycle that includes that squeeze, but also a release. Both are equally important. If you're able to go for an in-person training session or appointment, then they can test where you are, because some people need to work on relaxation and some people need to work on that toning and tightening. It just depends on where you are. And I said all of these are geared to retrain your body and get those nerve endings unblocked so they can fire and send the right messages. The third specific guideline I want to give you is that you will be adjusting repetitions in your Kegel exercises. I mentioned the tightening and the releasing or relaxing. So that is unique for each individual because your symptoms, your situation is completely specific to you. And you will change in how you are doing. Let me give you an example what that could look like weeks 1 and 2. You might do 5 sets of exercises that include the tightening and the relaxing, and you might hold that squeeze for 4 or 5 seconds, and you might relax in between for 4 to 5 seconds. And after 2 weeks of doing that, and they suggest do 5 of those, but do them 4 times a day. So do the math, that's 20. Not overwhelming. And we really don't want you to be overwhelmed. We want you to stop before you get to fatigue. And just realize that as your program, your process continues, then you will be making adjustments to that. Now, here I want to tell you some common mistakes and things to avoid. I have a list of 5. Number 1, people contract the wrong muscles. So we're not tightening your thighs or your abdomen or even your buttocks. This is pelvic floor, and that's why there's a little in training. What does that feel like? Where are those muscles? Number 2, don't hold your breath or brace yourself. We want to be present and make sure that the emphasis is on the energy that the muscles are creating. Number 3, we don't want you to do exercises on a full bladder. You're going to have a different sensation there. Number 4, don't overdo it. That can cause a problem. We don't want it to lead to fatigue or pain. And number 5, a problem is if you have irregular practice or if you stop before the benefits have time to accumulate. You're like, yeah, did that a couple weeks, didn't notice anything different. Well, that is when it helps to have another type of monitor so that you can assess it, because within your body you might not be able to identify that, but at least you can get a good start here. And I want to give you a real life application. Whenever you feel you're going to cough, you're going to sneeze, or you're going to lift a heavy object, then that's when you can contract those pelvic floor muscles right then. So you are fortifying yourself in one of the typical situations where there might be extra work and extra effort. So real life application is to use your pelvic floor muscles if you cough or sneeze or are doing heavy lifting. Now, I know this might be overwhelming. This might be new news. This might feel like, oh my gosh, I'm uncomfortable thinking about it, talking about it. Maybe you need some emotional support, because I can tell you firsthand, when you go in for therapy, they are there to help your body, which is wonderful. But we are made in God's image. We are spirit, soul, and body, and you might want some help to process this emotionally. It's change. It's seeing yourself a different way. You might also want to talk to your husband about this, ladies, and that might feel overwhelming and uncomfortable. So maybe you need some relational support. I would love to be there for you. Why don't you give me a call, just a discovery call, to see if working together would be a good fit for you. I'll put the link below, but you can always go to my website. It's limitlessintimacy.com. There's tons of resources there for you, and definitely a place for you to contact and schedule that discovery session. Hey, thanks so much for joining me today. I hope that these tips have helped you, and I want you to remember that God's design for a thriving marriage is an intimate connection in spirit, soul, and body.